As the coronavirus pandemic spreads, worries that poorer nations won't be able to cope. Health systems are weak in many of these countries, and millions of people don't have access to clean water or sanitation. So, how can we avoid a catastrophe? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. Coronavirus infections have now been reported in nearly every country in the world, and the number of people getting sick in Europe and the United States is rising rapidly. But scientists warn the next big spike could occur in developing nations with already weak health systems. Johns Hopkins University in the US has been tracking the pandemic for the past 3 months. Now, there's a huge concentration of cases in China, Iran, Europe, and the US, fewer infections in Latin America and across Africa, but those numbers are ticking up in countries like Nigeria, for instance. Africa's most populous nation is also battling the world's largest outbreak of Lassa fever, a viral disease more fatal than COVID-19. Liberia, where more than 4,000 people died of Ebola in 2014, it's declared a state of emergency. And in the Caribbean, Haiti is still recovering from natural disasters and an outbreak of cholera. The UN is asking for $2 billion to help poor nations.
I've just sent a letter to the leaders of the G20. I think it is clear that we need a much stronger coordination. Coordination in suppression of the disease, coordination in making sure that not only the developed countries can respond effectively to the disease, but that there is massive support to the developing world, not to let the disease spread like wildfire in the developed world.
Here are the main challenges that developing nations face in their fight against the pandemic. Millions of people do not have access to basic washing facilities, sanitation and hygiene, and many can't afford to buy hand sanitizers. Isolation is nearly impossible in densely populated nations. Outbreaks could be devastating, particularly in countries hosting refugees and internally displaced people. Many of those nations' health systems lack medical supplies or they're overstretched. And according to the WHO, poor nations spend on average $41 a person on healthcare, 70 times less than richer countries. And so let's introduce our panel. Joining us from New Delhi is Sujatha Rao, a former Secretary of Health in India. From Hull, Massachusetts in the United States, we've got Dr. Sheila Davis, the CEO of Partners in Health. And from Nigeria's capital, Abuja, Ifeanyi Nsofor, a doctor and the Director of Policy and Advocacy at Nigeria Health Watch. Welcome to you all and thank you for joining us. I'll start with you, Ifeanyi, in Nigeria. And it's a question I'll pose to all of you. Do you think that the countries outside the epicenter of the coronavirus so far, so countries in Africa, Latin America and India, they're going to escape the worst, or are we waiting for it to come to them? Ifeanyi.
Okay, thank you so much for having me on the show. I think bearing in mind the recent measures that have been put in place by Nigeria and other African countries, by shutting the borders, stopping flights from coming into the country and to the continent as a whole, we may be able to escape it. However, we know there are challenges that we have that are peculiar to us. So some of those challenges that we have include, like you mentioned when you did the intro, the very densely populated cities that we have, very, weak public transport system. And I think, in Nigeria, religion is also a big issue because, people believe that some of these things will not affect them because of, the kind of God that they worship. So, I'll keep my fingers crossed on that because I know that in Nigeria, most of the cases for sure are imported. But the major challenge we have now is, tracing the contacts of those cases and everybody that was on those flights that came in with, with those cases that have been confirmed so far. And that is going on, but also is also proving a bit challenging for, for the public health authorities that are tracking these cases.
Okay. And Sheila, have the countries in the developing world spotted the dangers early enough, do you think?
I worry that we haven't done enough testing to actually know the full burden of disease. I think there's been very little testing that's been done in many places at Partners in Health works around the world. There's been good efforts the governments have tried. There just has not been access to testing and the right ability to do the PCR tests, which can usually only be done in central labs. So I worry that there's more of a burden than we think there is. I do think that when governments have done a good job in trying to, shut down their borders, et cetera, but we know that there's certainly this virus has gotten around that already in other places. So I have fear that once it's in a country, we don't have the health systems to be able to address the real issue, and our morbidity and mortality will be higher.
Sujatha Rao, India has closed the country off to international flights. It's now stopped domestic flights. Has India done enough to nip the spread of coronavirus in the bud?
After the initial hiccups that they had, India did take up a sealing of the borders, as you said, suspended the visas after a while. And today, as from Sunday onwards, they have locked down the whole country. So social distancing is being taken to its logical conclusion of very, very seriously. You know that we are a federal government with several different political parties governing different states. But even then, there has been a united purpose. And it's very impressive that the whole country has been locked down. Having said that, the challenges are whether this has, should we have done this a little earlier, or is it really bang on time? And we've used this window of opportunity that we have till the end of this month before we suspect that the infection may get into the community. Then it will become very, very difficult because due to the density of population and the unevenness and inequities that are there in the health system, it may be difficult to cope a very large surge of patients coming up at the same time. So the strategy right now is really to flatten the epidemic and take what it comes, but in doses which the system can cope with. So I think in this little window that we have of 1 week, we are hoping that the lockdown will have beneficial impact. And secondly, we are also expanding the testing. Till now, we were only focused on those who came from abroad, but now we are going to be testing every patient who shows up in a health facility, public or private, with symptoms that may resemble corona flu. So that should then really be able to give us very good information as to the trajectory of this infection and where the virus is. But it's going to be a huge challenge if it has spread more than what we are expecting right now.
Okay, thank you. And Ifeanyi, for many countries, population in the developing world, population density is a challenge. You've heard of this lockdown in India. In Nigeria, only partial lockdowns in Abuja and Lagos, Lagos particularly very densely populated city. Has Nigeria done enough, or should it be doing much more very quickly?
Okay, so to be honest, Nigeria has not done enough in that sense. But we have to bear in mind that Nigeria is a federation. So there's a federal government, the state governments, and local councils. The federal government has shown, tremendous leadership in coordinating and making sure that states actually adapt the measure that they put in place. And apart from Lagos and Abuja, there are some other states that have also, put in place, shutdown of their domains. If one of the states close to Abuja here, Niger State, there's a curfew from 8 a.m. to 8 p.m. Kano State, which is also a very densely populated state in the country, similar to Lagos, has also put some, similar measures in place. And across the entire country, because civil servants that work for the federal government are in every state, the Federal Civil Service has also put in place measures to ensure that workers that are, from level 1 to 12 do not come to work, they work remotely from home. But having said all this, I think state governments in Nigeria really need to do it a lot more. And I need to go back again to the fact that Nigeria is a deeply religious country. Religious leaders have an awesome responsibility in this regard because even as at last Sunday, when the federal government had announced that we should limit social gatherings in churches and burials and stuff, some mega churches still held services that people attended. So they have a very important role to play, our religious leaders, to make sure that people stay at home, because we know that when less people go to work that can work remotely, people can work remotely, people don't go for social gatherings, then we can even begin to manage, the population that would go around in public transport. You mentioned Lagos. Lagos is a place that once you talk about infectious disease, people get scared because of the density.
Okay.
But I think since this, even before the outbreak came, we got our first case, the Italian who came to Lagos. The Lagos state government had already set up an incident management committee that is headed by the governor. So that level of political commitment is what we want to see replicated across every state in Nigeria, because if we don't do that, then it kind of becomes scary when this infection begins to get to places like Borno State, where you have internally displaced persons as a result of the Boko Haram insurgency.
All righty, fine. And sorry to interrupt. Sheila, can I ask you, what are you hearing from your colleagues on the ground, places like Rwanda, Haiti, Peru particularly? What are their main concerns as they see what has been happening in Europe and the US?
Yeah, I think Rwanda, for example, has done a very aggressive job in contact tracing. So when they've had cases, they have done extensive contact tracing and isolation and quarantine as needed, and I think has taken a very proactive approach. In other places, I think the government in Haiti is trying. I think the same challenge of density is there, and there's also quite a bit of fear and stigma and of people who potentially have the virus. So similar to what we battled during Ebola in West Africa, a lot of community education is really critical. So people are not fearful of people who have the virus, but are encouraging them to get care and to allow us to do really deep community outreach. If we get into the same situation that we ended up with for a while during Ebola, where people were shunned and there was not, people were not encouraged to get care, then we're going to continue to have a lot of community transmission. So I think a really effective community outreach, as well as facilities all the way up through the ministries of health, has to be the way to go.
Sheila, you were in Liberia during the Ebola outbreak. I mean, what was the biggest lesson you think from there that you've been able to, that you can pass on to dealing with coronavirus?
We were in Sierra Leone. I spent most of my time in Sierra Leone, some in Liberia, but it was clear that we had to reduce some of the fear, and we had to engage our community partners. So we mobilized the survivors to act as community health workers, to go out and do case finding and find people. And that's the strategy that we're utilizing now in Partners in Health countries, is to utilize our community health workforce to be going out, and we're training them to be contact tracers and to be doing a lot of education. Because if we took too long to do that during Ebola, and we kept it very, very separate. And that really caused a lot of people to delay coming in for help and assistance, which allowed the virus to continue to spread.
Sujatha, the coronavirus is putting healthcare facilities in developed countries under enormous stress. Could India's healthcare system handle a severe outbreak of coronavirus?
It all depends on how intensive and how spread out it is, and the number of cases that we get. Because at the current pace, we've just had 9 fatalities, and about 500 are reported to be the infected persons. So it seems to be manageable if this is the way it is. But we've had a surge, and if it's going to increase at the current rate, then we may be ending up with a very huge disease burden. And our system, our health system, won't be prepared to take a very large caseload, particularly in the northern part of the country, which is poorer and has a weaker health system. We have shortage of doctors. We do have problems of ICUs per million population, and even getting the PPEs, the protective gear, and those kind of essential consumables could be a challenge. But we are aware of these challenges, and the government appears to be taking action to try and, still focus on the prevention and not let and disrupt the transmission of the virus to get into the community. That still seems to be the best bet for us and the best strategy for us. But having said that, if it does get exponentially, if it spreads in a very exponential manner, we will have to deal with it. But then no system in the world, no country in the world can deal with very large numbers, that's for sure. We're just hoping that we have adequate capacity. We are roping in the private sector and the public sector. The facilities are being marshaled, and we are getting in doctors from both the sectors to work together. There is right now a huge unity of purpose. We'll have to see as the epidemic unfolds. But it is going to be definitely a very major challenge to the health system.
Okay.
That's for sure.
Okay, and we're all used to hearing by now about the importance of social distancing and the importance of washing your hands for that all-important 20 seconds. But Ifeanyi, when 3/4 of the households in developing countries don't have access to soap and water to wash their hands, what do you say to people when the most important thing they can do, they can't do it?
Okay, I think first of all is to remind people that WHO says you should wash your hands with soap and running water for at least 20 seconds. But running water does not necessarily mean water coming out of a pipe-borne water in your homes. Running water could mean somebody pouring water while you're washing your hands. So that is a reminder that we give people through our firm Nigeria Health Watch, and we also need people to understand that there's a trade-off here. So you need to go to the extra mile, because you know that if you don't do it, these are what some of the consequences are. So that you realize that you're doing it, you're not just saving yourself, but also you're saving your family, you're saving your loved ones, because everybody really has to chip in. As serious as COVID-19 is, but at least we know that the preventive measures are very basic things that people really ordinarily should be doing on a daily basis. It's just that at this point in time, we just need to reiterate the fact that people have to do this, even if it means going the extra mile to do it, because we know that people don't have pipe-borne waters in their home. But then running water is somebody also pouring water for you while you wash your hands. And this is something people really have to commit to, because doing it is really for public good as well as for public health.
Sheila, there seems to be more of a recognition across Africa of the dangers posed by coronavirus than compared to Latin America, where there seems to have been a bit more of a mixed message. Mexico and Brazil not initially taking it that seriously. Have you noticed that in Latin America? Are they less alert to the dangers there, do we think, at the moment?
I think, in Peru, our team in Peru has been working very hard, and the government there has been very, very proactive in the areas we work in really advocating to get rapid testing in the country, in tests that were purchased from China, and have very much said they wanted to be proactive about that. In Mexico, I think there's been less of an effort. But I think in Haiti, there's certainly been a people being very aware and not knowing exactly how to address. When the Dominican Republic got a few cases a few weeks ago, we all anticipated and waited for the onslaught, and it hasn't appeared yet. Again, I think partially because of the lack of testing, but I think there's 9 cases now in Haiti. But I think they're trying very much to address this. I think the lack of a robust health system is this is where this becomes even more evident. We don't have enough beds for people to have normal care, to have C-sections for women, obstructed labor in many places that we work. So adding this on top of that, the regular routine care that people are not showing up for is also really going to impact people's lives. And we often don't talk about that. We often talk about just the virus or the pandemic itself. There's a lot of the secondary things that people are not going to be getting care for as well, which are going to be very problematic and cause deaths.
We all know how insignificant social media is, particularly in the developing world. Sujatha, we know in India you've had problems in the past with fake messages spreading on via WhatsApp groups. How important is it to control the message in India to clamp down on fake news, on fake cures and rumours of fake cures?
Oh, there's a state called Maharashtra. You might have heard of the place Mumbai. So that's the capital of that state. And they've issued a regulation that any fake news any news on corona through WhatsApp, they will take action. They will, they're keeping complete control on the kind of information that's being shared, even on WhatsApp, which is an encrypted site. And actually, one or two people have been, taken to the prison and so on and so forth. So they're trying to, but then, the social media is such a wide network. It's going to be difficult, except that through the mass media channels, we are they're doing a very good job of giving the right information, trying their best to inform the people as to how the infection is spread and how it doesn't spread, and not to go in for voodoo theories of cure and treatment, and to come to the facilities and to the hospitals. That's going on. But then in a vast, huge country like ours with all kinds of beliefs, this is likely to happen. It happened in the HIV epidemic. We saw that. And now that with this infection, with the kind of speed with which it has traversed throughout the globe, there's bound to be these kind of rumor mongering and this kind of fake news being spread. Okay. It's a challenge, but I think they're trying their best to regulate it.
And Ifeanyi, you mentioned the importance of religious leaders in Nigeria, a very religious country. Are they being responsible? Because in the past, it's religious groups that have spread fake rumours about previous viruses and epidemics. Are they paying attention this time around?
Well, some are, but to be honest, we've seen videos of some very ridiculous statements, some of the religious leaders have made in the past 5 days or so. But I think what is happening is that a lot of people are really also beginning to push back, at least on social media, when they see such messages. People realize that this cannot possibly be true. People are pushing back. But if there's anything we've learned through the work we do in Nigeria Health Watch, is that we cannot assume that people actually know about some of the public health messaging, especially religious leaders. So what we do is to try to engage them for them to see the reasons why they need to give this, need to make sure that their messaging are really pro-health. But in particular, with respect to this outbreak, we've seen some very ridiculous statements ascribed to religious leaders. And we hope that as we go forward, a lot more of them will become more responsible to ensure that the messaging they put out is very positive. Let me give you an example. But you see, the religious leaders are also a product of the society. Last week, we had an opinion poll of about 1,000 people across the country to ask them about their perceptions of the coronavirus. And 26%, said that they believed they were immune to the coronavirus. And the reasons those 26% gave include things like they feel that they are children of God. They feel that this disease is for Africans. They feel that they take enough herbs that will protect them from this particular disease. And the fact that all 40% of the 26% said that they believe that they are children of God, that kind of takes you back to what the kind of teachings that they get in churches or mosques, wherever it is they worship normally.
Ifeanyi, so, I just need to squeeze one last question in to Sheila, just very quickly. Sheila, the UN says it wants $2 billion to help pay for the developing world to tackle coronavirus. Who's going to come up with that money when they've all got problems of their own? The developed world has got enough on its plate. Are people going to pay, do you think?
I hope so. I think that people will appeal to people's humanity to realize, although it's challenging here, we know it's going to be much more challenging in a place like Haiti, where there's one ventilator approximately for 1 million people. So I hope that people will be able to look beyond their own backyard and know that there's challenges here. But at the end of the day, most of us are in a functioning health system where there will be death and destruction, but nowhere to the levels that there's going to be in places in the world where there are such weak health systems. So I'm hoping that humanity will prevail and that people will reach out and try to build a health system, not just for the emergency, but so that we can mitigate the next emergency that's going to come, or at least give people a chance.
All right. Thank you very much. Unfortunately, we are out of time, but thank you very much for your insights. Thanks to all of our guests, Sujatha Rao, Sheila Davis, and Ifeanyi Nsofor, and thank you too for watching. You can see the programme again anytime by visiting our website aljazeera.com, and for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Bernard Smith, and the entire team here in Doha, bye for now.